All right, so the bill to cut healthcare to pay for tax cuts for the super wealthy is out. We've reviewed the bill, and we now know how they're going to cut your healthcare. Their bill calls for these 7 cuts. Number 1, they're going to require low-income families that are already struggling to pay all their bills, they're going to require them to pay extra every time they see a doctor. Number 2, they're adding all of this paperwork and red tape to make it harder for people to get their healthcare. This all has to do with what they're calling work requirements, even though they know everybody who can work is already working. They've tried this in multiple states. The only way they get the money they need to pay for the tax cuts if people who are eligible for healthcare never get it because of the paperwork and red tape. Number 3, they're trying to kill the Affordable Care Act again. They're just using a different tactic. They're trying to take away subsidies for about 5 million people. 5 million people will lose their health care because they can no longer pay for it in the marketplace. Number 4, this is a huge one. They are shifting the cost of Medicaid to states that can't afford it, and then they're saying you cannot use the provider tax to raise revenue. So they're essentially giving them the ball and then tying both hands behind their back and saying, oh, you dropped the ball. I guess we'll save a ton of money and we don't have to provide health care for hundreds of thousands, if not millions of people. Number 5, they're getting rid of what's called retroactive coverage, meaning that if you're in a nursing home or need emergency services, you get retroactive care. Not anymore. It will hurt a ton of people. Even though you can't use Medicaid for abortion care, they're going to take Medicaid and say you can't use it for anything at Planned Parenthood. Not for mammograms, not for birth control for men and women, not for STD testing for men and women. You can't use it for any health care at Planned Parenthood. And number 7, they're reducing the minimum number of nurses at nursing homes. When you add all this up, it is at least 13 to 14 million people who are going to lose their health care. Probably more. There is overwhelming bipartisan support for tax relief for working people, small businesses, farmers, the middle class. The only thing we disagree on is tax cuts for the super wealthy. This is a fight that is about life and death. That's how we're approaching it, because people will die if they lose their health care.